A pretty massive change in the way people who have hearing loss can get some help. For the first time starting today, the FDA is allowing over-the-counter sales of hearing aids to adults who have mild to moderate hearing loss. The goal here is to offer less expensive options to millions of Americans who otherwise can't afford hearing aids. Now they'll be able to go to Walgreens, CVS, Walmart and pick one up for as low as $200. A federal report estimated that nearly 29 million Americans could use hearing aids, but only about 20% of them actually have such an aid. Joining us live now is Dr. Jill Bernstein, an audiologist at Hearing Evaluation Services of Buffalo. Great to have you on the show. Thanks for your time.
Thanks for having me.
So first off, I wonder, when we talk about this, it's not a small number of people impacted, millions of people. Who are those folks who will benefit from this? Because I think the numbers there might surprise some folks.
Yeah, so these are devices that are specifically targeted to people with more mild hearing difficulty. Most of these folks aren't coming to see audiologists anyway for help right now. So it's giving them a way to get some help for their hearing health, being able to do it on their own from home, and doing it in a simple way.
And Dr. Bernstein, once someone's hearing loss progresses to a certain level, that's not what we're talking about here, right? That's the point at which they're going to go need to see someone like you and get something that is sort of a different type of device, right? This is for folks who at this point have mild to moderate loss.
Absolutely. This is for really more mild difficulties, situational difficulties, but really the best thing to do to find out if this is appropriate is if you're starting to think that you're having trouble, come and see an audiologist so that we can do a baseline hearing test. We can help you understand if this is a good option for you and also rule out really simple things like, maybe you just have earwax in your ears that needs to be removed and then you'll be hearing better from that.
What is some of the homework that someone can do who's watching us at home right now and who maybe thinks, I kind of fall into this category where I feel like I have just a little bit of hearing loss before they maybe go to the CVS or Walgreens or Walmart and pick out one of these cheaper items? What kind of homework should they be doing?
Well, it's still early days to see what's out there, what will be a good product, what might have a good reputation and provide good benefit. But really, again, I emphasize the first step is coming to see an audiologist to get your hearing tested to really make sure that you're in the category that this is designed for. Most people, by the time they acknowledge that they have hearing loss, they're actually past the point of mild to moderate difficulty, and this is no longer an option. So if you're really just starting to have trouble, come see us. We'll make sure that this is appropriate so that you're getting good benefit from it. And if it is, then you can go out and do some research about what your options might be. And if you need help with them, you can still always come see an audiologist and we can provide some assistance for using them.
Yeah, I've only got about 30 seconds left, but I wanted to kind of ask you about that. Is there worry among folks in your line of work that people will skip that trip to the audiologist now that they can just go directly, and buy one of these things?
There is some concern. We want to make sure that this is really people with mild hearing loss and people aren't using this who should be more appropriately fit with a more prescriptive device.
A lot of great information there. Dr. Jill Bernstein is an audiologist at Hearing Evaluation Services of Buffalo. It's a big change today, and this, of course, opens this up to a lot more people who otherwise wouldn't have been able to take advantage of this before. So thanks for helping us understand it.
Thank you.